Welcome to Osteoporosis and Exercise. In Module 1, we'll cover symptoms, background information, and risk factors. Then in Module 2, we'll look at screening and treatment. And then we'll finish up with Module 3, looking at exercise issues for people with osteoporosis. Now we move on to Module 2, where we'll look at screening and treatment for osteoporosis. In terms of screening for osteoporosis, the clinical assessment that's used worldwide is known as the FRAC score, or the fracture risk assessment. There are 12 questions, including a bone mineral density score. If that's not known, body mass index is asked for, and it assesses the 10-year probability of sustaining a fracture. It was developed by Sheffield University back in 2008 and now is used internationally. If that score comes out as a little bit concerning or high, the next step is to have a DEXA scan, and that's when the bone mineral density is actually tested. They tend to take two measurements, one at the hip and one in the lumbar spine. As a result of the DEXA scan, you're given what's known as a T-score. Now the T-score is the standard deviation of your bone density from that of the average 25-year-old woman, if you're a woman, i.e. how far off the ideal are you? You can see from the various values and definitions here. Under -1, you have healthy bone density. If your bone density or your T-score is between -1 and -2.5, you're categorized as having osteopenia. If it is lower than -2.5, that's osteoporosis. And if you're lower than -2.5, and you've had one or more fragility fractures, that's categorized as having severe osteoporosis. So if you're found to be osteoporotic, what treatment is available to you? On the pharmaceutical side, the most common class of drugs that are prescribed are bisphosphonates. These work by preventing the osteoclast cells from actually breaking down the old bone, or the resorption process. The most common of the bisphosphonates are listed there, and the advice is to take on an empty stomach and remain upright for 30 minutes after you take them, i.e. not just before bed, because there can be some digestive issues. Other pharmaceutical treatments that may be prescribed are the selective estrogen receptor modulators. These mimic the effects of estrogen, which as we know is protective against bone loss. There are also a couple of hormones produced in the thyroid and the parathyroid glands that can be prescribed. These help with the regulation of calcium. And the next two listed there, calciferol and cholecalciferol, look like they might be something to do with calcium, but in fact they are vitamin D2 and D3. Hormone replacement therapy, HRT, has also been shown to have a beneficial effect on bone health, and therefore that may be prescribed as well. As with all pharmaceutical medications, there are side effects to be taken into account. As exercise professionals, it's just worth bearing in mind that there may be a little bit of muscular fatigue, nausea, heartburn, and that sort of thing as a result of taking these drugs. They may feel a little bit under the weather at the time of taking the medication, a little bit achy and flu-like. So just bear that in mind on a day-to-day basis when you're taking them through their exercise program. The advice or recommendations given to someone with osteopenia or osteoporosis are the same given to promote good bone health at any age. Namely, these are to ensure a good calcium intake. Now, calcium is needed for healthy nerve and muscle function as well as good bone health. And if your intake is low, your body will rob Peter, i.e. take calcium from your bones, to pay Paul, as it were, as it figures that nerve and muscle function is more important than strong bones. So it is very important that you're getting sufficient supplies of calcium. Secondly, because calcium uptake requires vitamin D, it's very important to be getting adequate sunshine exposure. We've already discussed this, and as you know, you cannot actually absorb vitamin D through glass or through sunscreen. From foods like oily fish, eggs and liver, but daily exposure to sunlight is what's really required to ensure adequate vitamin D levels. Both work together, vitamin D and calcium, to rebuild bone. Exercise, this is the big one for us, and we'll talk about this shortly. Just before we get into the exercise do's and don'ts, Just a little heads up on vitamin D. It seems that it's a pretty important compound all round, being linked with optimal functioning in many areas of the body, as you can see from this slide. It's obviously beyond the scope of this course, but it's possibly worth investigating if you have an interest in this area.